All right, guys, I see some questions already coming in. We're going to wait another few seconds and we'll get started. All right, guys, we're actually just 1 minute shy of 8 p.m., but I'm just going to get started. Good evening, everyone. For those of you who don't know me, my name is Wyatt Polk. I'm an advocate with OCD, and I'm here to answer any and all questions regarding OCD. I myself do have it as well, so I'm here to, share my perspective, my point of view, and be the best help I can. I did a webinar with Dr. McGrath also a few weeks back, so definitely check that one out as well, and all the wonderful resources OCD has to offer. But I see some questions here, so let's just get started right away, so I can help best I can. So the first one I see here, this is, what's your advice on how to deal with guilt and rumination from overexposing myself with ERP from the start? I let my bravery take over. This is from Joe Z. So Joe, advice on how to deal with guilt and rumination from overexposing myself with ERP from the start. I don't think you're alone with that. I think that many times when we start ERP, I know for myself especially, when we're dealing with, some of these, intense topics or things, again, that matter to us, because that's what OCD likes to trigger or attack. There sometimes are those emotions that are, guilt and rumination, guilt rather, right? That's the emotion that you listed. I think the biggest thing there is to really kind of sit with that guilt. I know that, again, I'm not a therapist, so this is just something I had to kind of go through myself and still do to this day. Again, not perfect, right? So sitting with certain emotions, allowing those emotions to be okay. I think that's one of the biggest things. And the ruminating part, maybe you can go do something else. Maybe you can get up and maybe take a walk. Maybe you can do something. And again, that's not, in my opinion, distracting yourself or avoiding a situation, but I think it's also just kind of redirecting your focus that, hey, like, I can sit here and I can ruminate till the cows come home. I can think about this all day. And I don't think that's going to change the answer for you though, right? Like that's one of the things I've also learned, that there's never really an answer that OCD's never really been satisfied, to say the least, right? So to that end, there's really only one other option I see personally, which is to get up and keep going. And I know that sounds easier said than done, but I believe in you. I think you can do it. And many people on here probably deal with that same thing and can attest to that. But it's, again, one thing at a time and starting very small. Right. Let's keep going. Next question. It says, how to deal with from my POV point of view, how to deal with stopping your mind from convincing you have another disorder. This all started a few days ago. So I know deep down I don't have this disorder, and it's just OCD, but my mind won't stop. See, that again kind of reminds me of the question we just had prior about the whole ruminating situation. Again, when we're ruminating, it doesn't lead us anywhere down the path. It's really just playing OCD's game, taking that bait, right? I think that sometimes you can maybe address, again, the first thing, let me back up a step. The first thing would be working with a therapist, because again, the therapists are really trained to help us kind of dive deeper into these core fears, dive deeper into kind of how we can approach this, and give us really tactical and practical ways that, hey, to step by step. That's the first thing I would recommend, really reaching out to an OCD therapist if you haven't already, because they have great resources. And again, I was kind of, not to, I didn't really want to do it at first, to be very straightforward. I was a little apprehensive and just wasn't sure it was for me. But again, I was diagnosed in, let's say, I think I started therapy let's just say last spring. So let's just say around February of 2021. But I've been working with a therapist throughout these months, and also I've had OCD my whole life, or believe I've had it my whole life, as far as I can remember, really. So again, it's really just one of those things that you want to work with a therapist for, really get in touch with them. And if it's something that's just day to day and you're just like, hey, how do I stop convincing myself? I would say stop trying to convince yourself, right? I would just say really just don't even play that game. Again, try to refocus, have a routine, maybe try a different activity, do something different, try to keep your mind going. And again, not avoiding, right? Kind of just letting things be. One of analogy I heard one time is, you know, don't stir the pond. And essentially that really just means that, say that your thoughts, you want to ruminate, you want to dwell, you want to go into it. That's really stirring the pond. And when that happens, those ripples really take place and the pond is moving. But the more you can kind of just let things be and let them be at peace and let them be still, the pond eases. It might take some time, but again, to not stir the pond is a really effective way to kind of refocus and let your emotions kind of run their course. Next question. Any advice about feeling like your insight is poor with harm OCD or relationship OCD? Yeah, I mean, the first thing I thought of, Bella, Eloise, is possibly like awareness. I think sometimes that, OCD wants to take us on a path towards things, again, that matter to us. So insight is poor with harm OCD or relationship OCD. I think that speaking with a therapist can really give you insight as to what these things entail and really can you can get a better grasp of what this means. And you'll also find when working with a therapist or an OCD or just, it could be one of the groups that they have with other individuals, that you're not alone. A lot of people deal with these things. And I think that also could probably offer some better insight. Anna says, how can you tell if it's OCD versus ADHD versus social anxiety? I'm incredibly awkward and nervous in social settings. I have OCD, but wonder about ADHD. So Anna, you're not alone there either. I was diagnosed with ADHD as a child. I'm well into my 20s now, but yeah, I can understand where you're coming from a little bit. And again, was recently diagnosed with OCD. So I think the best thing to do here would be to speak with a doctor, speak with a professional, to see how you can kind of distinguish and kind of work through what would be best for maybe each or any or all encompassing, right? So I think that's something you could work with a medical professional, because it's kind of outside of my bounds of expertise. Potato 2K says, hi, can you explain HOCD, please? If you're referring to harm OCD, sure, that's one of the themes that I also actually kind of deal with sometimes, whether it's self-harm. A lot of times I feel like that's not spoken about as much in terms of harm as usually harming others, but what about harm being done onto you, right? That's one of the things that sometimes has been triggering for me, harm OCD as a whole. So I think that harm OCD is, again, like I just mentioned, it could be hurting others, thinking about hurting others, thinking you want to hurt others, thinking things can happen to you or hurt you or your family or people you care about. Again, the whole point is it's something that you care about. It's something that matters to you, or triggers you, and that really is the harmful part of it, right? Because you're kind of triggered into thinking that, hey, like this may be something that I want or don't want. And again, that's that path that OCD wants you to take. But that's some of the insight I have to harm OCD. I'm sure others have different perspectives as well. And working with an OCD therapist can also help you break down what harm OCD means for you, right? Or what that the real core is underneath that as well. Hallie Darlin says, have you ever had experience with OCD erasing your sense of self? So I think that might fall into the category, maybe, I don't like to categorize things necessarily because I'm not an OCD therapist, but it sounds to me similar to like existential OCD, or maybe even like somatic OCD, more existential OCD, like sense of self. Similar, again, I've dealt with, this is part of my theme as well, and I kind of categorize it also into that harm category somewhat. And yeah, I mean, yeah, yes is the short answer. Again, but working with a therapist and kind of just challenging OCD in the ways that we know are best through ERP are things that can really help you get a grasp on that, and also help you just kind of help you kind of unpack those fears, those core fears that go along with your statement, your message there, your question there. So many questions. Great questions so far, guys. Keep them coming. I might have to wrap up a little early. It's 8:08. We'll probably go to around 8:45. I just wanted to throw that out there. I forgot at the beginning, but please keep them coming if you have them. I'll try to answer them the best I can. All right, I think this is the one I had as well. Ivana says, what will it take to learn to recognize whether a thought or sense of anxiety is OCD or just a general or reasonable concern? That's a great question. Great question, Ivana. I think that a lot of times, it's easy to get caught up in that. Even that question is like something that just reminds me, like that can take you down a path of like, rumination right there. But I think that letting things kind of be, that's the one thing, the kind of example I mentioned earlier of like not stirring the pond. I try to, when things are really bogging me down, or I say triggering to me at the time, and I just, I feel that kind of urge, almost like, again, taking the bait. I literally picture like a fishing pole trying to bait me towards it, reel me in. And I just try to just be still for myself. This is my personal experience. And I try to really just refocus on something different, exactly whatever the intention was. So if I wake up and I have a script of, hey, or a plan, like, hey, this is what I want to get done in my day, this, and this, I just try to, whether, I feel that urge to stop and think about these kinds of things or whatever the case is, I just keep going. I just really keep going because I think for myself personally, it's been kind of getting bogged down in these types of questions that have caused me to even begin ruminating. So, and again, I'm not trying to say to avoid it or anything of that nature. I just think that a lot of times you'll really know at your core if there is a real general concern. And I can give an example, I guess, like one time, like, I think that one example that I heard from a therapist was, really something you can use is your awareness, kind of using your surroundings. So like you kind of like look both ways, is there any immediate danger? And again, that might not be the most relatable example in terms of literal danger, but you can use the same template or format of example. Okay, like, look around, kind of think to yourself, is it anything that really needs my concern at this moment? And if not, you keep moving. And it's that quick because, again, if you spend any longer, in my experience at least, it kind of leads to that path of rumination where you kind of keep questioning or doubting or, and that's something I try to be more consistent about and hold myself accountable for, not ruminating. Jen says, how do you not let thoughts move from anxiety to just depression or from being exhausted by it all? Jen, trust me, this is exhausting. And even today, not perfect, like at all, not perfect. And a lot of these things can be exhausting. A lot of this, dealing with OCD. So I commend you for just dealing with this and just dealing with these anxiety. And you mentioned depression. It's, you should be proud of yourself. But how do you not let your thoughts move from anxiety to just depression, from being exhausted at all? So for myself, I'm a very active person. So personally, again, you can use this template. It doesn't have to be the exact same things, but I am a very active person and an early riser. So I like to wake up early and stay kind of focused on what I want to do. If I want to, every morning I keep a small promise to myself. That's really how I kind of like, don't even let myself get bogged down really into the whole depression and like those types of like, I try to really not just keep going. Just stay focused on what I wanted to do for the day, whether that's go for a walk or, whatever the plan is, right? Whatever the plan is, get work done for my job, all the things with my family, my fiance, all the things that I want to do, have spend quality time, because I try to like break it down, not to just be very simple. Like, do I want to spend my time, worrying all the time, or do I just want to keep moving? That's something I spoke about with Dr. McGrath on the webinar we did. He always mentions the band Rush, and I think he said the drummer, forgive me, Dr. McGrath, if this is not correct, but something along the lines of, just basically get busy living. That's what I took from it, and or get busy dying. And for me, get busy living really just epitomizes like, hey, I just want to keep moving. I just want to keep going and doing the things that matter to me. Because at the end of the day, I don't want to look back on my day or week or whatever and be like, you know what? I spent a lot of time just distracted. I know it's not as easy as that necessarily, but it's bit by bit, day by day. And working with a therapist can also help you put plans in place to help you move forward. Okay. So Akshai B says, certain things related to trauma trigger OCD obsessive thoughts. Any suggestions? I think that a lot of people could attest to that. There's OCD usually triggers things in us that kind of bring up certain emotions, certain thoughts, certain discomforts, feelings, sensations, images, urges that can leave us uncomfortable. And I think again, one of the biggest things you can do is work with a therapist to utilize the gold standard ERP. I think ERP is something that can really help you. But again, working with a therapist, creating a hierarchy, and really just kind of working through whatever traumas that and triggers that you have would be really beneficial for you. So if you haven't reached out to OCD, I really recommend it. Again, I was apprehensive at first. But it was very helpful working with them on some strategies to really help. And ERP was the gold standard. CMO 54, tips for dealing with contamination OCD with my partner. Obsessing on when and how often she showers or washes her hair. I feel repulsed. Contamination OCD is not necessarily one that I personally kind of deal with at the moment, but I think that, again, working with a therapist, I don't want to give you anything that I can't really attest to in terms of it, but I know that the gold standard would be exposure and response therapy, really identifying what could be an exposure for you to maybe reduce that repulsed feeling, or not even reduce that repulsed feeling, kind of expose yourself to that repulsed feeling and then prevent a response. So again, working with a therapist would be best for this. Again, I don't want to speak to this one too much just because contamination OCD isn't something that I can attest to. Desk job made my picking ruminating so much worse. Any tips on that? Hey, so Hallie, darling, good question. I work remotely for a company, so I kind of understand the ruminating part. I'm pretty much home throughout the day working, so I can understand how it can cause ruminating to be kind of worse. You're kind of like at a desk job, or even if you're in person at a desk job, you're kind of just have more time to kind of like sit and maybe think or ruminate potentially. So I think that staying focused, getting work done, essentially, and sometimes things that things that have helped me have been maybe podcasts, listening to podcasts if I can, if I'm able to at work around meetings and so forth, so on and so forth. Busy work, things that I really want to accomplish, whether that's writing or reading or whatever the case is, just trying to stay busy. Again, not avoiding things. Again, when thoughts pop up or anything kind of, things that maybe might induce rumination pop up, just kind of keeping it moving. That's really the best thing I can suggest. And I know it's not as easy as that necessarily, but staying focused is bit by bit, day by day, maybe even if it's 5 more minutes, like you're like, hey, you know what, for these next 5 minutes, I'm just going to do this instead. Or maybe if it's less, maybe it's 30 seconds, maybe it's 20 seconds, whatever the case is, and then try to increase that every day. Or the other way around, right? Maybe, you know what, maybe you've been ruminating, but be patient with yourself. And maybe it's that day you're going to go 5 minutes less, just 5. But if you do 5 minutes less in a week, that adds up. That's 35 minutes if you're doing a 7-day week, or a 5-day week, 25 minutes. So, and again, that week by week, along with working with a therapist, along with really kind of holding yourself accountable and being disciplined, that can really go a long way, I believe. So many good questions. I don't want to miss anybody's so far. Okay. I think it's skipped down again. It does that. Okay. Okay, so next question is from Allison. When my OCD leads to temporary depression symptoms, sometimes I don't feel like I can feel anything, and I don't get excited for normal things. How do I not obsess about not feeling right? Oof. That's a triggering one right there, Allison. I can really empathize with you for that, and I commend you for even sharing that. I know that's not easy. I understand. I think one of the biggest things that for myself, I'll just speak from, of course, my perspective with dealing with this, is that whole idea of, I read the question again about feeling right. That's something that can kind of feel tricky because, OCD doesn't care about your feelings. It doesn't care about your family. It doesn't care about your triggers or traumas or what you want to just stop. It's not relevant. It's not relevant. What matters is what you're going to do about that, right? Because I know that a lot of times we don't want to necessarily feel a certain way, but I think that again is kind of falls into that trap of that emotional reasoning, which is again, if you're feeling something, then that may indicate the way things are. And I think that that's baloney personally. And I think that we're stronger than that. And I think that that's something that, again, working with a therapist on ways to expose yourself to that, maybe not feeling right, could be one of the best things you could ever do, working with an OCD therapist to work on that, because that's something that I still deal with every day, and I'm working every day to help myself with. So I think exposure and response prevention, again, on really identifying what maybe things don't allow you to feel right, and kind of learning to kind of habituate. Inhibitory learning is something that really is important in terms of the ERP and OCD recovery, and just allowing you to just work on that through exposure. And of course, the most important part, the response prevention to that not feeling right. Julia Bianco says, how can you tell the difference between intrusive feelings and real feelings? Well, good question, Julia. I'm not a therapist. I don't know really, I guess, maybe science behind feelings or anything at all. But I can, again, from my own point of view, I think that all feelings are at least legitimate. My personal opinion is that feelings are not to hurt us, to harm us, but to teach us. And I think that, however, for some reason, OCD tries to take advantage of that. That's my personal opinion. So I think that the best thing to do is feel feelings, right? I think a lot of times when you're doing an exposure and response prevention, for example, say one of my triggers is harm OCD, and if it brings up feelings of guilt or feelings of anxiety or doubt, I need to really, again, for myself, sit with those feelings of anxiety and guilt and just not ruminate on them, not dwell on them, but let them just kind of like be, because again, that's the best way that I've learned can teach you to kind of habituate and just not give it the same reaction. But the more we kind of like are repulsed or maybe afraid or kind of steer away from our feelings, they grow bigger, they go larger, or necessarily more scary, quote unquote, right? So I think the best thing to do is kind of, I say, put it on the fridge, right? Kind of if it's guilt, let the guilt be there. If it's anger, let the anger be there. If it's sadness or fear, let the fear be there. But showing yourself that it's okay by sitting with it is the best way to learn how to deal with it. That's the best advice I have for my own. Oops, sorry about that. From my own personal opinion. But great question. All right, guys, we're rocking and rolling. All questions are welcome. Well, we have a bunch actually. So why does OCD, let's keep going. Why does OCD make you think your thoughts are completely rational? It's only until you're out of it that you have an almost complete different mindset. That's a great question, Hannah. So I think that, again, I'm not a doctor, physician, or OCD therapist in any way. So I can't really speak to the science behind like the why OCD makes you think your thoughts are real. But I do know that, again, with working through a therapist and from educating myself through webinars and through all the content that NoCD provides, that OCD really tries to attach to things you care about. Right. So that's one of the things where when you said, why does it make you think your thoughts are rational? Well, maybe because you care about something that OCD wants to attack. And it's only till that you're out of it. That part I'm not sure really what you mean. Maybe you mean like you're not feeling as anxious or the feeling isn't as strong. But again, I try not to get too wrapped up in how I'm feeling about a certain thing. Because as Dr. McGrath has said, and many times OCD likes to lie, and it likes to paint some kind of, picture that's just a big fat lie, right? So again, I try not to even buy into that and just kind of, just keep going, knowing that how I feel is how I feel, and OCD can say what it wants, but it is, it is what it is. And I think that, working with a therapist would be probably the best way to really unpack how maybe the why behind everything, the why behind the science behind it necessarily, because they provide very valuable information as well. Amy Corbett, I have really bad intrusive thoughts of harming my maybe that means, I'm not sure exactly, but it says I love them so much. It's so distressing. I've just come back from hospital because of it. Wow, I commend you very much, Amy, for really being a warrior and just kind of dealing with what you're going through. And I appreciate you sharing your question. I think that a lot of times intrusive thoughts can be, it's hard. It's not easy. I'm talking up here like it's easy. And again, I'm from somebody who deals with intrusive thoughts every day. Like today's just another day, so I understand. And I just really want to say thank you for sharing, because I know that it can be hard. And I think that maybe working with NoCD in the support groups and hearing other people's point of views, perspectives, maybe on a weekly basis can help you. Maybe that's something you're really interested in. And I know it's not easy to always reach out to an OCD therapist. Again, I keep mentioning this because it's very true. I was very apprehensive to do so. But even with the support groups, I myself might even start doing some of the support groups, because I find that just interacting with people who also have OCD and are going through similar things really just provides a whole new perspective. So I think it's something that can be valuable for you as well. Oh, I see here in the second thing you said harming your dog. Oh, I understand too. I have a small dog as well, so I understand. And again, harm OCD is one of the themes that I've deal with as well. So I just commend you for sharing that. CL says, I have OCD, but have too much fear facing the gross and or scary things that are around my apartment to even be able to clean it. Well, CL, I understand that fear is an emotion that we all have. It's something that, again, people with OCD have and people without OCD definitely have as well. And I think that it's something that, if you're, when, and if, it might always be it might always be like a time to feel ready. I hope people can understand what I mean by that. Like when I started in OCD therapy, I was the opposite, I think, of feeling ready. But I think at some point you have to ask yourself, what's important to me? Is it important for me to recover, or is it important for me to just kind of, be bullied by OCD? that's what it is. It's just a big bully, right? So I think that, taking that first step and reaching out to an OCD or reaching out to somebody you trust who can possibly get you in contact with the right kind of therapy for you or the right kind of situation to help you work on this would be great. There's so many resources on OCD's website. So please, 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 just even if you want to like go play around on the website until you feel comfortable reaching out to them. When I did the first time I spoke to them, I felt so much more comfortable after speaking with them than before. And then every time speaking with them after that was great. Again, the ERP, the work isn't always the easiest at all. I'll be very upfront about that, but it's something that's helped, and I can attest to that. From my point of view, I would get a therapist, but when I tell my parents, they tell me I don't need one and I need to snap out of it. Nothing is convincing them, even when I'm stressed, anxious all day. Hey, I think that it's really, I commend you for even speaking with your parents. That's something that, not a lot of people even do really feel comfortable sharing with their parents, but great job for at least sharing it with people that you feel like you can speak to this, with this about. I would think that maybe speaking with them again and just trying to get them to kind of understand, try again to understand where you're coming from, or even maybe make that initial call yourself would be something that can even help you. Maybe show them that you take it seriously, because again, OCD is something that is pretty. It's a debilitating thing. So I applaud you again, and I just hope that you can work with them to do what's best for you. Beth Beeson says, I have been diagnosed with OCD. Does OCD make you doubt you can do things you've been doing for years and years? For example, I've suddenly developed driving anxiety. My apologies. I've been driving for years. So Beth, I believe that OCD will it tries to attach to things you care about. So I think that OCD can try to make you, why wouldn't it try to make you doubt something that might matter to you? I have been playing basketball my whole life. I played in college, and it tries to make me doubt things about that. It doesn't really matter what necessarily the content of like what, but OCD will try or can try to attach to things that matter to you, maybe don't matter to you, maybe try to make you think that it does matter to you, whatever the case is. So I definitely think it can, and I think that that's something that again that can be worked on with an OCD therapist to really kind of put some to work with ERP to just kind of work through that. Bobby N says, I have sensory motor OCD that isn't widely mentioned, but can be extremely distressing and debilitating at times. It deals with awareness of body processes and sensations. So yeah, Bobby N, thanks for sharing. I can attest to this one too a little bit with the sensory motor OCD aspect of this. I definitely deal with that and have dealt with that a little bit as well. I don't really see that it's a question, formatted in a question, but it is something that isn't mentioned often. But again, working with an OCD therapist, they definitely have a lot more information on sensory motor OCD and can help you with structured and practical, ERP therapies that can really, or strategies rather, that can help you face exactly what you're working on, especially when you work through and tell them what you're dealing with. So I really recommend that. Amy Corbett again says, I've been diagnosed with OCD. How do I know I'm not secretly a psychopath though? I'm not laughing at the question. I'm just, I understand because I've questioned that myself. I think that again, that's that doubt. The first thing I thought of was the word doubt. And again, OCD likes to make us doubt. But again, working with an OCD therapist on exactly ERP around this type of issue can really help you, I believe. Again, I'm not going to get into like ERP or kind of like reassurance in this case, because that's something that again I'm not licensed to do. But I think that working with a therapist can help you because it will help you confront a lot of these core fears behind this question you're asking. It's not easy to kind of dig and kind of get to those core fears and build the hierarchy and just go through the steps necessary. But I think at the end of it, it's all worth it because if anything, it gives you courage and allows you to see, hey, I can do this. That's what it has done for me. Great questions, guys. We have a bunch more time, so keep them coming if you have them. I'm gonna find where I was at, and let's get some more questions going. Okay, so I'm gonna try to go to one I haven't seen before, a person's name. Jenny Chavez says, can you go more into ROCD and how not to let it affect your relationship? So for those of you who don't know what ROCD is, it is like considered relationship OCD. I'm not really sure exactly what specifically you're dealing with ROCD, but I know that it can be debilitating for couples or for who are cases to kind of deal with this. And I think that again, working with a therapist can help you learn how to not let it affect your relationship. If you mean by affect, you mean like separating or no longer being together, something like that. Again, but for myself, I have dealt with some aspects of relationship OCD as well. But again, I think therapy and ERP is the gold standard for how you can not let it affect your relationship by putting in the work now and kind of seeing where that can take you. So I applaud you for sharing this. But again, since I'm not licensed, I can't really speak to more of it than working with a therapist that knows OCD. Mm-hmm. West Indy says, I've been experiencing OCD, but I was diagnosed with ADHD since I was a child. Do you think ADHD have anything to do with that? So I as well was diagnosed with ADHD as a child, West Indy. So I'm not necessarily sure of the relationship, but I think that again, working with a therapist to make sure that you are diagnosed with OCD. I'm not sure if you mentioned it here. Would be the best thing, and also working with them to understand maybe the relationship between the two. That's actually a great question that I myself kind of want to look into as well. Peach says, I'm struggling with contamination OCD and I can't tell if my thoughts are real or not. What do I do? All right, Peach. I think that contamination OCD is something that a lot of people deal with. And so I commend you for even sharing this. I think it's something that you can work with a therapist on. Again, I'm going to always mention that first because they can always put in a plan and strategy to help you. But I think that contamination OCD can be worked on, through ERP, exposing yourself to things that may be contaminated or not. And again, maybe trying to let them be and then let those feelings come up that do arise when you do kind of work with that exposure. I know it's not easy, but it's probably the best thing for you to really work on ERP around anything that you feel is contaminated or not contaminated or whatever the case is specifically for your situation. Okay. Great questions tonight, guys. Great questions. I'm happy I'm able to answer as many questions as I can. So we have one from Love Lana. Love Lana says, my 20-year-old son has this need to have numbers like TV volume, etc., on even numbers. Anyone else needs certain things done on certain numbers. So this is an interesting one as well. I think that to me that just reminds me of almost like that just right type of situation, and then you have this like almost like this urge that if it's not, something might be wrong or whatever the case is. Again, I'm not sure exactly what your son is experiencing, but I think that again, connecting him with a therapist that can help expose him to dealing with this type of situation and these types of situations, especially around even numbers, something that like that, or numbers, or maybe just right things. I remember Dr. McGrath at one point, I remember he mentioned something that was really, really powerful because for myself, I'll give an example that sometimes I've dealt with, feeling the similar way, maybe needing things right, or maybe having to pray just right, or something of that nature. So certain types of things in that regard, maybe doing something a little off, right? Just a little off, maybe not exactly right. Right. So, maybe if he wants the number to be number 10, it's an even number, let it be number 9 or 11. Right. So again, these are things that a therapist can work with, but I know that that's something that was mentioned and I really find value in that. Kind of having things be just a little off. Right. He mentioned, I think his Dr. McGrath example was maybe something in a cupboard. If you put things in there a certain way, maybe leave the towels a little askew or a little to the right or a little to the left and not just in there the way you like them, and kind of sit with it. Let it be. And just kind of see what comes up and kind of let that pass. That's just an example of an ERP exposure, but that's something that can be consistently practiced through OCD with a therapist for your son. Love Lana. Dania Rum Says, can OCD latch out of nowhere? So I think that a lot of times OCD triggers things. It can, again, it can for sure. I think that a lot of times if people go through a traumatic event, things can be triggered, but sometimes it's not always something that's a traumatic event. It could be something that maybe builds, or people are different. We are complex beings. However, again, working with, it can come out of, I see that Amy said, just mentioned, it can come out of nowhere. So I really think that, yeah, it definitely can. I think that working with a therapist can kind of unpack maybe fears around maybe where it came from. Again, trying not to go into the content too much and answer that, but I think that it definitely can, to answer your question, come out of nowhere. Great questions tonight, guys. What time is it? We are almost there. So I see another question from Dania Rum that popped up. It says, I feel like I sometimes believe my intrusive, obsessive thoughts. How do I stop doing that? So I'm not going to give you any reassurance about how to stop doing that, or tell you what's right or tell you what's wrong, because that would be no. But I can tell you that that's something that's, if I had a penny for every time I've heard that, thought that myself, or I think I think I'd be pretty rich here. So I think that that's something that's really common, in my opinion. Again, other people can share their experiences as well, but that's something I believe is common with OCD. That whole idea of this notion of belief. But again, working with a therapist beyond with that would be the greatest thing for you, because again, you don't have to buy into it. You don't have to take that bait, like I mentioned earlier with my example. But again, there's never going to be something that really satisfies OCD. I always like to remind myself of that, and that's something that, again, it's been hard for me to kind of grasp around that, grasp that. But I think it's something that's very powerful to understand that. So I would just say, keep going, work on that with a therapist, and you'll be okay. And great, thank you for sharing that as well, because I know that's not easy. All right, guys, we're almost 40 minutes in. It's 8:35. I don't see too many more. I don't really see any more questions in the chat. So you are welcome, Dania. No problem. Yeah, I see one more. So yeah, so if you guys have any more questions, we can go for another about 10 minutes. If not, we'll end shortly. But again, thank you guys so much for asking all these questions. You guys are brave people, and I really appreciate you guys for doing so. And and appreciate that you value my responses. Again, I deal with OCD daily, so I understand where you guys are coming from in some regards. And thank you again. I see another question here. From Amy. It says, what's the best way to stop engaging in compulsions? Well, Amy, that's a little hard to answer, I guess, without knowing specifically what compulsions, but I'll speak more generally towards compulsions. I think that the best way to eliminate ruminating or compulsions, because again, compulsions can be physical compulsions, or they can be mental compulsions, where we're just playing things back in our mind, we're ruminating on things, we're asking ourselves if things are true, if they're not true, how we feel, all these different types of things. So it really depends, but I think the gold standard around doing so is really, for me, again, my own experience is to take a step back and try to choose awareness in the situation. I try to remind myself what I prefer to do in a situation, and even if things aren't feeling necessarily right or feeling necessarily the best, still sticking to that, right? Keeping those small promises. So at the beginning of the webinar, I mentioned every morning I go for a walk. I don't care. It doesn't matter if it's raining. It doesn't matter if it's snowing. It doesn't matter how I'm feeling, right? But I keep a small promise to myself. So that's one way for me to kind of choose awareness. And day by day, I try to keep small promises to myself that allow me to kind of build and kind of eliminate, or lessen rather, engaging in compulsions by keeping small promises. So that's one strategy I use. Again, working with a therapist, they can provide many different resources and tools. But I think the other way, the answer that people are probably tired of me saying is ERP, to be very honest. Exposure. And again, the most important part of the ERP is that response prevention. So we're preventing a response towards compulsions. I think that even that question itself is an exposure you can practice right now. You can prevent a response from even wanting to know the answer to that, to be very honest. JB says, I've tried everything I know. If things don't change, I'll be stuck with OCD. What's the solution here? I think that just being consistently, again, I'm not sure if you've done therapy with no OCD. I'm not sure if you have, worked with them or not. Again, I don't see any further information in the chat about it, but I think that JB, the biggest thing that you can do is continue to work on your helping yourself. I think that's one of the best investments anybody can make, is really working to help themselves and value that work that they put into themselves. Because again, it's not easy. If it was easy, it wouldn't be, most things that we care about in life that are easy are worth it. Most things that are hard and take a little grit and take hard work are worth it. And I think that putting work into yourself and really does matter and really is worth it. So just keep going. And I really advise, if you haven't, or even if you have reached out to an OCD, reach out again, work with them again, and work to see what they can do to help. Stephanie Berrios says, what do you struggle with? Meaning, what themes have you had and how do you deal with it? Yeah, great question, Stephanie. So again, as mentioned earlier, I've dealt with harm OCD thoughts. I've dealt with some relationship OCD thoughts, but a lot of mine have to do around like harm. A lot of times the things that have helped me the most have been ERP, and whether that's exposing myself to certain feelings or images, urges, sensations, again, working with a therapist doing so, and without a therapist, and just kind of sitting with it. I know that some people find that answer very kind of like boring and kind of like, well, yeah, we know, but that's really the truth. And I think that it's a simple, that's the one thing I feel like I've learned. It's simple, but not necessarily easy. That's the thing, right? So really, to get back to your question, ERP has been something that's been invaluable because it's just taught me that I have the courage and I can continue to kind of work on things and find practical and strategical ways to break down these OCDs, the core fears behind everything. But again, like you said, like I mentioned, harm OCD, kind of relationship OCD, some existential elements of OCD have been some of the things I've dealt with. Thanks for asking. Chauncey Carter says, how do you feel about taking medication for OCD? Great question, Chauncey. I actually have not taken medication for OCD. I know of individuals who have, from watching webinars and so on and so forth. And I know that it can be very helpful for individuals, whether that's SSRIs, whatever the case is. People are different, but certain medications do help and have helped many people with OCD. So I do recommend speaking with a therapist because, again, I cannot attest to that myself, but working with a therapist to figure out if that's and doctor to work with that, to see if that's the best option for you or whoever you might be referencing. Or yeah, great question. Casey says, does EMDR work for OCD associated with trauma? I'm not going to lie, Casey, I'm not really sure what EMDR means. If somebody could let me know, I could definitely possibly a form of therapy. But again, I'm not really familiar with what that means. But so I can't really speak to that one. Great chat, guys. Good job. So Johnathan Herron says, is it OCD when you keep doubting you have OCD even though you have symptoms? I think personally, again, I'm not a therapist and I'm not a trained in any way. Again, as other than more of an advocate and somebody who deals with this myself, this sounds like something that just straight out of an OCD, almost out of an OCD textbook. I think this type of question is one of those ones that try to bait you in and kind of just even debating, like, do I have OCD? Do I not have OCD? Is this real? Is this not real? I think that really is ruminating, to be very honest. So I'm not going to answer this question other than challenge you to possibly sit with it. Sit with it by noticing how it makes you feel and focus on whatever you were doing before you asked that question. That's something that, again, I would do, again, my personal experience. And you don't have to like it. It's just what I think would be best for this specific question. Because again, that is a reassurance there. Oh, I see. Lavana says eye movement, R, and desensitization. So let me find the question. Does rapid eye movement desensitization work for OCD, for OCD associated with trauma? Again, I'm not too sure. I'm going to go back to that question. I'm not too sure, Casey, but I think that working with a therapist would be great to reprocessing. That's the R. Would be great to figure that out. I can't speak on that too much, but thank you for filling that in for me in the chat. Guys, we are just about done. If there's any more questions, I'll look. But other than that, guys, thank you so much for a great webinar. I hope I've been a help to somebody. The way these webinars have helped me, And thank you guys so much. We're just about there. But thank you again so much. And I hope you guys have a good night. Again, if you guys really do want help and the standard of help that can really help you work on OCD, I'm telling you guys, reach out to OCD. They're a great resource. They have invaluable resources on their homepage. They have the app that you can get in contact with people. There's chats on there. There's weekly events. There's weekly support groups, and it really is a big step. Even if you're thinking about doing it, I urge you to just try and just reach out. It's something that can really help you, and I hope you guys do. And I hope all of you who are dealing with these things and have asked me these questions tonight understand that you're not alone. Understand that we all are going through this together. So I hope you guys understand that. And thank you again for your time. All right, guys, have a good one.